are you doing today?
I'm good. How are you?
Good, good. My name's Maddie. I'm going to be your nurse today. Hi. Can I get you to verify your name and date of birth?
Yes. Alexandra Dyer, 012599.
And do you have any allergies?
Gluten.
Awesome. And a couple questions before we get started. Do you know where you're at?
The doctor's office.
Do you know what day of the week it is?
Wednesday.
And do you know what the most recent holiday was?
New Year's.
Alrighty, so patient is A&O times 4. And then you look good, you're dressed appropriately, your mood seems great. So today I'm just going to be doing a physical assessment. I'm just going to be going from head to toe. And then the CNA did check all your vitals. So the CNA did check all your vitals. So blood pressure was 120/84. Pulse was 64, respirations was 16, temperature was 98.1. Are you experiencing any pain today?
No.
Alrighty, so I don't need to do a pain assessment on you. Alrighty, so first I'm going to start off with your head and I'm going to work my way all the way down to your feet, okay? So I'm just going to check your head. You're standing at 98%. No bumps, scars, or lesions. Your head feels great. Alrighty, I'm going to check your ears. No drainage. Looks good. Alrighty, no excessive redness. And I'm going to check your nose and your mouth. Your nose and your mouth look good. No drainage. Your gums and your mucous membranes are moist, pink. Everything's intact. Alrighty, so next I'm going to go down to your neck, and I'm just going to feel to make sure your trachea is midline, and negative for goiter when I palpate your thyroid. Alrighty, so next I'm just going to palpate all of your lymph nodes. So I'm going to start with your preauricular, postauricular, occipital, your retropharyngeal, your submandibular, your submental, your anterior cervical chain, your posterior cervical chain, and your clavicular. Alrighty, so all of your lymph nodes were non-palpable, which is good. Alrighty, so next I'm going to check your carotid pulse. I'm going to check this one. And then if I could have you look that way for me. And then look this way for me. No signs of JVD. So then I'm going to listen to check for any bruise. And we'll check this side. And while I have my stethoscope on, I'm going to go ahead and listen to your apical pulse while I palpate your carotid artery. And for this, I'm going to have you take your shirt off if you're comfortable. And I'm going to do that under your breast. And on the other side. Alrighty, good. So now that we're done with that, I'm going to test all your cranial nerves. So for cranial nerve number 1, I'm going to check your sense of smell.
Okay.
You can cover that.
Lavender.
And if you can cover the other side.
Eucalyptus.
Alrighty. And for cranial nerve number 2, the CNA did check your vision, and you do have 20/20 vision with the Snellen chart, so that's great. Alrighty. And for 3, 4, and 6, I'm going to check for Perla and your 6 cardinal field of gaze. So Perla, just pupils are equal reactive around the light, or pupils are equal around and reactive to light. Alrighty. Alrighty, and if I could just have you follow my pin. Keep your head straight for me. Alrighty. So 3, 4, and 6 are intact. Alrighty. and your pupils are parallel. And then I'm just gonna have you smile for me. Raise your eyebrows. Move your jaw from side to side. Alrighty, so your facial nerves 5 and 7 are intact. And then I'm just gonna whisper something in your ear and tell me what you hear.
Okay. Dog. Cat.
Good, good, good. Alrighty, and then for 9, 10, and 12, are you having any problems swallowing?
No.
Alrighty, and how's your gag reflex?
Good.
Good. Alright, can you stick out your tongue for me? Good, good. Alrighty, and then if I could have you stand up for me, please. This is also testing number 8, and I'm just gonna have you stand here for 30 seconds. 30 seconds goes by, no swaying, you're good. Alrighty. And for 12, I'm just gonna have you push up against my hands. Good. 11's intact. Alrighty. Beautiful. Okay. So after that, I am going to go ahead and have you stand up one more time. Sorry.
Okay.
I'm gonna have you walk back and forth for me. I'm just testing your gait and your balance. Looks good. Alright, go ahead and sit back down. Alrighty, and if I could have you twist your hands, and then if I could have you take your right heel and place it to your left shin and go down, and then switch sides. Alrighty, rapid movements are good. Alright, so next we're gonna do a little bit of range of motion. Or first I'm gonna inspect your skin, okay? So I would have you take off your shirt again. Alrighty, so your skin looks good, no signs of edema. Temperature feels good. Alrighty. And then if I could have you put your arms out and put them up. Alrighty. And then go ahead and put them back down. And then I already had you twist your, yeah, okay. Range of motion is good. And I'm just gonna give you a little pinch, okay, to test your skin turgor. Looks good. Alrighty, I'm gonna check your capillary refills. All are less than 3 seconds. If I could have you give me a squeeze. All look good, beautiful. Alrighty. So next, if I could just have you kind of relax your hands, I'm gonna check your pulses. I'm gonna check your radial pulse. Check them bilaterally. Alright, 65. Looks good. I'm gonna reflex hammer. Alright, and then your brachial pulse. Beautiful. Alrighty, so next I'm going to check your reflexes. So I'm just going to give you a little hit, okay? So first your bicep, and your tricep. Did I mix that up? I'm sorry. Your bicep, and then your tricep. Alright. And then your brachial radialis. Alrighty. Check this one. Your tricep, your bicep, and your brachial radialis. Beautiful. Alrighty. So next I'm going to check your chest. So your shirt would also be removed if that's okay. I'm just going to inspect your chest for symmetry, see if you're using any accessory muscles. Alright, I'm going to place my hands on your back and check for that too. Breathe for me. Looks good. Alrighty, I'm going to use my stethoscope and I'm going to listen. Alrighty. I'm going to go to the second intercostal space, right sternal border. S2 is greater than S1 for the aortic. And I have the left sternal border. The pulmonic, second intercostal space. Third intercostal space, left of the sternal border. For the herbs. And then tricuspid is going to be the fourth intercostal space, the left sternal border, and then your mid-clavicular line for the mitral, apical. Alright, now I'm going to check your respiratory. Alright, I'm going to check in 6 places. 4, 5, 6, and then I'm going to listen to that apical pulse for a full minute. And I'm going to check your lung sounds bilaterally, or on your lateral sides, I'm sorry. Do 3 on the right and 2 on the left. Alright, and I'm going to check in 8 places in the back. Alrighty. Look good? Alright, so next I'm going to go to your abdomen. Are you having any problems urinating, or when was your last bowel movement?
Yesterday.
No funky odors?
No.
Color was okay?
Yes.
Consistency was okay?
Yes.
Alright, so I'm going to lift up your shirt and I'm going to inspect your abdomen. I'm going to check for any discoloration, hernias, anything like that. Look good. Alright. I'm not actually lifting your shirt, I'm sorry. Okay, so the inspection's good. So next I'm going to listen to each quadrant in your bowel, or each quadrant. Alright, I'm going to start with the right lower quadrant, right upper quadrant, and I'm oscillating for a minute in each one. Left upper quadrant, left lower quadrant, and if I didn't hear anything, I'd check for 5 minutes just to be certain. And next I'm going to percuss. Right lower, right upper, left upper, left lower. Alright, and then I'm just going to palpate a little bit. Left lower, or right lower, sorry. Right upper, left upper, left lower. Alright, and then I'm going to use my stethoscope, the bell of my stethoscope, to listen for any bruise. Belly button. Alright, looks good. Alright, you can go ahead and sit up. Alright, so next I am going to go down to your legs. I'm going to check your legs for any edema. I'm going to check for any pitting. I'm going to check the temperature. Temperature feels good. Alrighty. And then go ahead and put your legs down. And then the color looks good. You don't have any scars. And then we already checked your gait and your bounce, so that was all good. That's my time at 13. Alright. So, really quick, I'm gonna go ahead and check your cap refills before I start the range of motion. Less than 30 seconds. And I'm gonna check your reflexes. Alrighty. And then I am gonna, if I can have you put your leg out, and then put your other leg out, and then I'm checking for range of motion, so pull your knee up to your chest, pull your knee up to your chest. Alrighty, and then I'm gonna check your posterior tibialis pulses, and then your dorsal pedal pulses. Everything feels good. Alrighty, and if I could have you put your toes to your nose, and then press my hands like the gas pedal. Good, good. Alrighty, I think I'm done. Do you have any questions?
I do not.
Alrighty, well the doctor will be in shortly to see you. I'm gonna do my hand hygiene. And there's your call out if you need anything.
Thank you.